The OIO department is the Oncohematology, Immuno-Oncology department of CRCM. It's a very recent structure of the CRCM that now include 4 departments, including OIO. This is an important changement in the life of CRCM teams. For example, in the OIO department, we have now 6 research teams working together on the field of oncohematology and immuno-oncology. And that's important for us to have a better thematic coherence in the field of oncohematology, and that's one of the big objective of our department. So I think the idea comes from different needs from clinicians and needs also from researchers to have a better interaction between different research teams, but also to mutualize some experience and biological samples, for example, or interaction with clinicians. So that's something that is now necessary to upgrade the quality of our different research program, notably the translational aspect of the research that is more and more difficult now because more we know things about the disease, more we have things to look for, and the complexity of the new treatment and the new molecular classification of all the disease make that we need more and more diverse thematic around the oncohematology in the fundamental research, also in the translational research. And we need also structure to bring research from the bench to the bedside and also in the opposite way. So that's the global idea under the creation of a department. For a long time, actually, clinicians worked in clinics for allogenic transplantation without really taking into account new development of immunotherapy that can come from the lab, and also the different aspect of new technology to investigate immune recovery after transplantation, for example, were not directly applied to patients in clinic. And today we improve the quality of clinical care, but we face some limits. And to overcome this barrier, we need to go back to the lab to better understand more fundamental immunology and to develop also new therapy. If I take a very practical example, now we have a collection of biological samples from patients who receive allogenic transplantation. And these samples come from a clinic and they are obtained in very specific situations that are in the area of innovation. So they have innovative treatment. And based on these samples, people from the OIO department can ask some biological question and try to develop some models and try to find biomarkers or whatever. I think it's how to mutualize the biological resource we have in certain very attractive therapy. Also the transfer of new immune therapy, pharmacological therapy, or cellular immunotherapy is very important in the setting of cancer today, and the lab of Daniel Olive is a key player in OIO department on this aspect, because his team has the capability to transfer through biotechs or through academic platform, and notably the interaction here with the cell therapy facility of Pauli Calmette Institute to upgrade the quality of the cell therapy that are given to the patients. So. I think it's a kind of a beginning of a department in a sense, and we need now to formalize this department. To my point of view, it becomes more and more difficult to transfer a new therapy from the lab to the clinic by only looking at a single part of the history. I mean, we cannot say I will just develop a new immunotherapy without regarding data from microenvironment or hematopoiesis if you want to treat a leukemia patient, for example. So in that sense, it becomes necessary now to have in the lab different specific teams that can act together to propose the best model for developing a new therapy. I think you have seen the different presentation today. We were very lucky to have very great speakers and in different fields. But if I start with Professor Hartmut Donner, is a maybe top 3, top 5 key leader in acute myeloid leukemia in the world. And he also has a close connection with IPC because he's a member of our scientific advisory board. And to have the possibility to discuss our project with this kind of person is very important for us to take advantage of multiple connection outside the IPC, to have an overview on the very recent development. And he clearly showed us how fast the classification changed over time. If we are not very reactive on our project to be in line with what is developed in the world, we cannot be competitive. Now we started a transversal project in the Ohio department called LeukAge for leukemia and age. And this project will focus on a better understanding of the factor involved in the leukemogenesis, in what extent that these factors are related to biological aging of the cells. This is a transversal project inside Ohio, but also outside Ohio in the overall CRCM, because it also takes advantage of a collaboration with another department working of genomic stability. So that's a kind of example that we have, and all together we were able to apply for grants, for example, to work on that project. An example of some suggestion of projects arising from the discussion of today. We discussed, for example, myelofibrosis. That is not the main topic of the day, but we definitely agree altogether that there are a very important unmet medical need for these patients, and we need also model to have in vitro and in vivo models in the lab, and some team in the Ohio department work on that. Some other team work on the immune aspect of inflammation and microenvironment, and all these experience can converge on the patient with severe myelofibrosis, for example. For them, we do not have a specific treatment. And I think we can develop a solid project on that, but only if we take advantage of all the different expertise.